Welcome to Morning Moments. Thank you for taking the time this morning to join us. Uh, no matter what platform you're watching this on, Facebook, YouTube, or other platforms it's seen. I have a special guest today. I always enjoy having nurses on. This I've had the privilege to know the Ramponas based on marriage and we're family by marriage. And Scott Rampona is a registered nurse, another male nurse. There's not a lot of us around, but a male nurse, registered nurse, martial arts expert, but also somebody who loves God, a father and a husband. It's my privilege to bring to Morning Moments Scott Rampona. Welcome to Morning Moments, Scott.
Thank you, Andy. I almost didn't recognize myself there for a second.
Yeah, boy, it sounded really good, didn't it?
Yeah.
Well, Scott and I've known each other for quite a few years. His stepbrother married my daughter, and so we are family by marriage. So we go to a lot of family get-togethers, and we eat turkey together and open Christmas and birthday presents together. And but this time I wanted Scott to come for you to get to know him why I asked the question. Scott, tell me, what do you do and why do you do it?
Currently, I'm a registered nurse. I've been one as of last month, 21 years. Was a late bloomer. When I went back to nursing school, I was 28 years old, graduated just around the time I was 31, and pretty much been doing that ever since. Worked primarily, I began in intensive care unit, and then I transferred to level 1 trauma and emergency center, and I've been working in the emergency department ever since.
Yeah. You ICU nurses and ER nurses, you're the adrenaline junkies. I was that psych nurse, but you get right in there and love the blood and guts and all the action, right?
Well, we get a lot of psych too. Yeah, that's always that cherry on top some days.
Good. You also have done a lot of martial arts through the years, you're at a high level competition too, right?
I do. I actually, it all began with Taekwondo back in 1978. I had a taste of that. Probably within the last 10 years, I got into Krav Maga, which is kind of an Israeli special forces hand-to-hand combat system. Made my first degree level black belt before I transferred over to Brazilian Jiu-Jitsu. Currently, I'm a blue belt in that. Also picked up Muay Thai kickboxing as well. Kind of a second level student there. I wouldn't say I'm an expert at all. I know enough to, get myself hurt a little bit, but it's been great. It's great exercise, great stress buster. We have a very good family within the martial arts community. But I do like to compete. At my age, 53, not a lot of guys my age are, do that kind of thing, but I'm not old enough to play golf. So I figured I had to have something to do. So got my sons in it, got my wife into it. So it's fun and games right now, until my kids start hurting me.
Yeah, it won't be long. They'll be they'll enjoy it while you can, when they're small enough that you can get the upper hand on them. So you got a lot of irons in the fire. Why really do you do what you do?
So I said I've been a registered nurse for 21 years, starting off in college back in 1988 as a nursing major. Over time, transitioned over to a degree in history because I figured to get me out of college faster. I just had to get out, make money, get established in life, and sometimes youth doesn't always think long-term about what really is the best outcome. I joined the Army. I was United States Army Airborne Infantry for about 3 years. Got out, got into restaurant management. Again, a degree in history at that time, back in 1997, wasn't anything I really could do a whole lot with. And got a restaurant management for a miserable, horrible 7 months of my life. And I think sometimes God makes you very uncomfortable in certain situations. Sometimes where you're so uncomfortable, you got to move. You just can't sit there. It's, I'm going to get out of the frying pan. I'm going to take my chance with the fire. And I was in Indianapolis at the time. I'd gone to a little Christian school called Taylor University, kind of central Indiana. There was a school that was in our conference competitors of ours, Anderson University. So One day it had just had enough. And I literally just jumped in my truck and drove up to Anderson University in Anderson, Indiana. I walked into Hartung Hall, 3rd floor, science building, walked into the nursing department and said, I think the first words out of my mouth, what do I have to do to get in here? And fortunately, Pat Bennett, who was the dean of the program, just happened to be there and walking around in her business suit attire barefoot and just pleasant as peaches. And then she just called me in her office and said, come on in. And we talked for a little bit, and that was it. I ended up in nursing school. Of course, I was the only guy at the time to apply. So yeah, that was kind of my golden ticket in the door, I think. But it was a lot of prayer, I guess, and there was a lot of desperation that really, where I ended up walking into that building. It was like, I can't do this for the rest of my life. It was physically, our relationships was very difficult. Financially, it was just absolutely impoverishing. I mean, it was a dead end track to nowhere. And sometimes, as I said, sometimes God's going to give you in a situation where you got to move. You just can't sit. Otherwise, life's just going to beat you up in that position, and you're going to take hits, and you're not going to be effective at what your calling is going to be. And sometimes we don't know what the calling is. But I tell you, sometimes God, calls you to stay where you're planted, and sometimes He calls you to move. And that was the situation for me. It was like, I got to go. I got to move. And it's something that I had been really prayerful for over the couple of years, and that was just the situation where it's like, okay, this is where I got to act instead of just praying. And so I ended up in nursing school, 3 years at Anderson University. I was a single divorced parent at the time, and it was just me and my daughter. I lived in a little 1-bedroom apartment. It was actually a 2-story house, and it was just a house built in like 1913. There's no central AC. It was 1 bedroom, little kitchenette, didn't have a shower. There's like a little, 2.5-foot hose attached to the spigot, and that was my shower. But for 5 years and 8 months, and I remember thinking how tough life was at that time. But as I look back now and years ago, I mean, once I got established and I, you're faced with different sets of challenges in life, I look back and think it was some of the best times of my life, struggling through nursing school, praying God to help you through every exam. Always felt like, it was life and death, just hung on the result and outcome of every one you took. But I look back for, time with my daughter that, I cherish this day for that time that I had her there. And it was a good small town community where I was living at the time. But, God dragged me through, years later. I was graduating from Anderson University. I actually graduated second in my class, cum laude. And not that I'm the best nurse in the world. I am definitely not. There are things that sometimes there's so much going on in that, especially in the ER environment, where so much is you're just overloaded. It's not hard to miss things, especially on your critical patients, especially when you got multiple critical patients. You're trying to figure which fingers to stick in which dike at what time. You're running out of fingers and toes and resources and manpower, and definitely not the sharpest tool in the shed. But I look back and think, God doesn't always use the smartest and wisest. God uses people who make themselves available. And I've not done it perfectly, and I don't do life perfectly. Those closest to you can tell you, closest to me can tell you that. But you make yourself available. God will get you where you need to be at the right time, doing what you need to be doing, what you need to be doing. It really is. And a lot of it is, I think in any job, and I think particularly as a nurse, it's the mindset. It's one pastor, I think Pastor Stephen Furtick, Pastor Stephen Furtick over at Elevation Church down in North Carolina, he was talking about perspective is everything. And when I told my boss years ago, one of my bosses said, my job is to make you look good. Regardless of whether anybody likes me or doesn't like me, or, it doesn't matter. I'll do the best job I can, and I'll agree, if somebody's happy and they want to write a, kudos card, hey, glory to my boss, glory to God. Another part of that perspective is, as I said, I've been doing nursing for 21 years, and there are days where it's like, I'm dealing in a job where I'm not taking care of people on their best day. No. They're having tragic moments, life-altering situations for friends, for family, for that individual. But my perspective is, God called me to be those hands of healing for the moment I can, and I do what I can for the physical side. But a lot of times, and again, I don't proselytize or anything like that. Sometimes I say, can I pray for you? You'd be amazed in how many years I've been doing this. Yes, please. I've said prayers for people who are literally at death's door.
Yeah.
And you know, I've had people say no, thank you, and I've had people say yes, please, and majority do want some prayer, but just to give an encouragement. I'm dealing with young people coming in. What do you want to do with your life? What's your plan? What's your passion? What's your purpose? I can take care of the physical sense inside of things, but when they leave, they may not know Christ. And again, I don't proselytize, but sometimes you can kind of say, pray for you. Or God's got the plan and purpose for your life. When you walk out of here, you may not, take care of the physical side, but when you walk out of here, you at least have a sense that there's something bigger than you and a purpose for your life that you didn't have when you walked into this place. And the very least you walk out with, hey, just that seed plan that God can grow. And, just attitude. There are a lot of cranky people in the medical profession. I think we've all been taken care of by Nurse Ratchet or somebody who's just not real pleasant. People remember pleasant, and I always have a shtick, hey, my name's Scott. I'm your favorite nurse tonight. If you can't remember Scott the Hot, that's who you ask for whenever you come back here. And now there's some people I don't ever really want to invite back because there's some people, it doesn't matter what you do, you can't make them make them happy. But again, my perspective is, what can I do to add a little joy to somebody's life? And I've been overwhelmed with how many people appreciate that. Because sometimes humor is the best medicine, and I like to cut up obviously when situations are appropriate to do that. Sometimes it's not, but very least, going in, even I don't say say a prayer with somebody, just, hey, Lord, I just ask you to bless this person, just heal them up, get them moving, get them out, establish them in life, the plan and the road that you've got for them. So it's just kind of a multi-perspective approach, but all stemming from Christ, and how God wants to approach things. Nobody wants to, anybody can talk Christ. And again, we've all been there. I don't think there's anybody, except maybe Billy Graham that I could ever think of, or Apostle Paul, who maybe lived everything about as righteously at every time they turned. There are times where I, fail as a human, but at the end of the day, it's like, God, just help me make that one more step, with that one more step, in your direction, may I, breathe your word over somebody else, or set the example for somebody else to be able to see you and not me. It's not about me, and my job is to do what I have to do to heal you in the physical side, but be a blessing and enrich you when you're walking out that door. So it's just my approach to it.
Well, Scott, thank you for sharing your heart with me today and with my audience. I appreciate that. Remember Scott in prayer. He is still an active serving nurse. He's still out there serving and working many, many hours. So remember him in prayer. Matter of fact, right now, after you hear this interview, I want you to take a few moments, stop and pray for Scott. Scott needs your prayer. Folks, you need to practice. So pray for him that God would continue to bless him and God would use him every shift in every area of his life. Being a nurse, being a father, being a husband, that God would continue to bless him. Thank you so much for joining me for Morning Moments, Scott.
Hey, thank you very much, Andy. Appreciate it.
Thank you for joining me, and keep coming back now, if you would, for some more Morning Moments.